Okay, still in the provider tab, you have lensometry, IOP, keratometry, pachymetry. At this point, when I do the VAs, I'm just going to hit OK at the bottom of this screen. It closes it out and adds it over here to the grid. The lensometry you can do here also. There's many ways of doing the same thing in NextGen. You do want to make sure you have your normal oriented mood here. And then again, if you click external within normal, it'll just give you the normal. If you do copy last exam, it'll show you the last time they had this done was in June. And if there's anything abnormal, if we do it down here, maybe there's something abnormal. If they had cataracts, it would have showed us, or if they had cataract surgery. A PCIOL is a posterior capsular intraocular lens implant that is done after cataract surgery. If they have a cataract, there's different types. Typically, nuclear sclerosis is just a normal age-related cataract, 1 being mild, 4 being the worst. They could also have something called a posterior subcapsular cataract, or we also just call it a PSC. Again, 1 being mild, 4 being the worst. And then trace means it's very minimal. So these are different types of cataracts. Once you click it, let's see, we'll just say they have a 2+ cataract, it'll add it to the grid. On this other side here, if you wanted to say something about it, you can add little, if that's more relevant, maybe in the cornea, if they had dry eye, you could put superior punctate keratitis. This also we call SPK, that usually indicates dry eyes. You go over to here and you can say 1+, 2+ if it's significant. 1+ is always the most minimal, 4+ is the most severe. On this chart, you have your right eye on the left side of the chart and your left eye on the right side of the chart. This is your pressure measurements. I have videos on how to check pressure using tonometry with a Goldman applanator or also with a tonopin. So applanation or Goldman is how you do it with the slit lamp. Tonopin, you would click tonopin, you'd put in their pressure. Typical pressures range between 9 to 22 on average. Once you put their pressure in, you're gonna hit save and it'll add it for the day. If you're with a provider and you're helping them, they may do a fundus exam after they dilate. PVD is in the vitreous, it stands for posterior vitreous detachment. Patients typically experience floaters. If you are with your provider, they're going to give you what's called the CD ratio. They probably won't say CD ratio. They're just going to give you a number between 0.1 to 0.95. And you put those there. Vertical means vertical measurement of the optic disc number, and then the horizontal number. Often if you're doing scribing, they're just going to give you one number. Drusen would be in the macula. And you can also put in your dilation here where it says dilation, but it's already been put in, so we don't have to do that. But that's just another area you can put in your dilation.